February is Heart Month. Joining us now to talk about it is Dr. Lindsey Fish with the Urgent Care at Denver Health. Dr. Fish, thank you so much for being with us.
My pleasure. Thanks for having me again.
Yeah, we appreciate your time. So let's talk a little bit about heart issues and how to prevent heart issues. What should people do to prevent heart disease and other cardiovascular challenges?
Well, it's stuff all of us are really familiar with, but it really is important. It's little things that we do every day. It's eating healthy. What does that mean? More fruit and veggies, more lean protein like turkey, chicken, fish, nuts and whole grains. Fewer of the things we love, processed foods, sweets, and the white carbohydrates like rice, potatoes, white bread. Exercise is really important. We've definitely heard it, but it's 30 minutes of regular exercise most days, 5 to 7 days a week would be great. Exercise is important, but so is rest. So sleeping 7 to 8 hours a night is really critical. If you smoke, stop smoking and manage your stress in healthy ways.
It's a lot.
It is a lot. It's about making good choices every day.
Right, I know, just kind of adding in and sprinkling all of that in as much as you can,
yeah.
right?
And it's not about perfection.
Right.
It's about doing the best you can every day.
Yeah, so important. When people talk about knowing your numbers, what does that mean? Because we hear that a lot.
We do, and the numbers refer to medical conditions that increase your risk for heart disease. Okay. So things like knowing your blood pressure, your cholesterol, your blood sugar, your body mass index, and your waist circumference. If all those numbers are normal, your risk for heart disease is much less. But if they're elevated, we want to be able to treat you for those conditions to reduce the risk.
Okay, let's talk about the difference in men and women. We know that heart attack symptoms can be different in men and women. So let's start with women first. What should they look for?
So that's always the challenge, because actually we hear more about men. And men typically have a heart attack like chest pain or pressure, like an elephant on the chest. Frequently, men will have severe shortness of breath, pain in the neck or arm, or left arm or hand numbness. The problem is women's symptoms tend to be a bit more subtle and more mild. And women tend to have a little bit more upset in the stomach, sort of nausea, mild shortness of breath or fatigue. And so women really need to pay attention. If something suddenly changes from how they normally feel, they should really seek attention, especially if they have risk factors.
So that's something to really pay attention to. We also know Denver Health partnering with the American Heart Association. There is a goal of equipping all of us to save lives when someone is in cardiac arrest. Let's talk a little bit about what you guys are trying to do.
Yeah, so Denver Health, in partnership with American Heart Association, has a Nation of Lifesavers campaign. It's really simple. We want everyone trained in cardiopulmonary resuscitation, or CPR. It makes a big difference. If somebody has a cardiac arrest out in the community, as soon as CPR can be initiated is critical to ensuring their likelihood of having a full recovery. And the other thing that's really important to understand is that even kids can have issues where their hearts stop. And so we really want parents to be trained in CPR as well, so that heaven forbid something happens at home, they can start doing something to help save their kids' lives.
Yeah, super important. Dr. Fish, as always, thanks so much for being with us.
Thank you so much. My pleasure.
Great information. And we will be back with a check on your forecast after this break.